Good morning. Today we're going to do a special surgery. It's not going to be a traditional liposuction. It's a patient with a diagnosis of lipedema, which is always being confused with lymphedema disease. Actually, for lipedema, there are different criteria for diagnosis. Do you know the criteria?
Yes.
It should be 3 in 1 to put the diagnosis. This patient typically has the trousers-like painful on palpation, progressive swelling. So all these 3 criteria fits the patient, and that's why they go into an unbroken cycle. So they gain weight, they get worse, they can't do physical activity, they gain extra weight, and their clinical progress goes worse. So they go that re-entrance cycle, and to break that cycle, actually we perform a special type of liposuction technique for them. So one of the most crucial points that we should use always basket, as you can see here, the special tip that we have. Vibrosat technology is quite helpful for these patients. I believe it's much more superior than the wall technique because wall was introduced in Germany and as a different technology, and it was promoted to be very useful in lipedema cases. I have experience with it. To be honest, I believe that the best results are attained with the Vibrosat technology. Vibration expansion. One of the most crucial strategies in lipedema is that you have a strategy over the knee and strategy below the knee. Over the knee, you have to be very, very meticulous, and you have to be very careful when you're doing the liposuction. You should go in the deep planes, no superficial liposuction at all, and it should be in the vertical wise manner. No lateralization, no cross-matching, in order not to disrupt the lymphatic system and lead the patient to a complication of lymphedema or a recurrence in the disease pattern. Below the knee, you can go very aggressive, but please use very thin cannulas, not exceeding 3 millimeters in length. I think we have one here. We can show it to the audience. So that's a thin cannula that we can use below the knee. So let's start. Here's a deep plane that we have to go inside, about 2 to 3 centimeters deep, and then you have to be very, very careful and meticulous. So there's a boundary between how much that we have to do and how much we can do. Basically, the hospitalization for these patients is much more longer than the regular liposuction patient. We would be keen to keep them at least 2 to 4 days, and because they have a tendency to lose a lot of fluid and oozing after the procedure. Draining is crucial. We put drain. Extra wrapping is very important aftercare, and because they tend to ooze a lot. And of course, sometimes we might have extra blood loss that we have to compensate with blood transfusion. So all of these issues should be discussed with the patient prior to surgery. Sometimes it helps quite a lot, and then you can have some laxicity in the skin. That happens, which in this patient we would not expect a lot because she's still young. And then you have to aware the patient or inform the patient that they might need some, lifting surgeries afterwards. But to be honest, with a good rehabilitation after the procedure, with a very good rehabilitation, you can have good results. And basically, I think I have around 50 patients in the follow-up long term. They're all working good. About 3% of these patients, they had recurrency because of bad life habitual status. They don't take care about their diet. They gain weight, so they can have their recurrency with it. So this should be informed to the patient as well. So they have to be very careful in their weight and maintain their weight in a steady state. And any weight loss would be okay, but weight gaining means a problem. So there's another issue that we have to pay attention to, that most of the patients, they're not aware that they're lipedema patients, actually. They get obscured with their diagnosis. They go to a lot of doctors, and all of them, they say that you have obesity, and they recommend them diet. So they go into that re-entrance cycle. So somehow break that cycle. The first step would be the diagnosis. So in the internet, you can find a lot of information about lipedema. In the past, there was no awareness about it, but now there are foundations, associations regarding this disease, and we have to know that it has hereditary inheritance. So family history is very important, and this is one of the criteria of our diagnosis. There's something more important that I want to say. We definitely do a nuclear medicine investigation before we do our surgery, because we have to discriminate and put a true diagnosis in order not to miss lymphedema, because in a very small certain amount of patients, there might be a mixed type. They would have lipedema superimposed with lymphedema. So those patients are very dangerous, and they should be assessed in a meticulous way. So one of our prerequisites is to do a scintigraphy, a lymphoscintigraphy, which is a test that maps out the lymphatic system and the lymphatic vessels. just to be sure that their lymphatic network works properly before we go ahead and do the liposuction for them. And there's another important thing about the aftercare process is that it's not going to be like a regular liposuction. We have a special drape that we drape the legs or the extremities over the compressive garment, and manual therapy and rehabilitation for a certain time of period is also very important, and we definitely recommend our patients to visit those clinics and do that rehabilitation treatment after the surgery, and that helps a lot as well. Thank you very much.